Hi, my name's Jen. I'm making full videos about mental health in kids, and specifically mental health conditions in kids. Just to give a little introduction to who I am, so that y'all don't think I'm some odd person with some strange interest in mental health in kids. I'm a psychology student. I've also volunteered and worked in different areas with people with a variety of conditions, both adults and kids. And I was one of those kids. So I've been in all kinds of places, and I've seen different patterns, and I've also seen some of what psychiatry does well, and some of what it doesn't do well, same with education and mental health in general. And I've also seen there aren't a lot of resources out there for parents and for other people who just kind of really want to help, but don't necessarily have the medical knowledge or knowledge of the terminology to understand complicated sort of manuals and the like. Before I go on further, though, I would like to give a disclaimer. I legally cannot diagnose, I cannot treat. I'm not a physician and I'm not licensed. So while I can give, little tips here and there, while I can, maybe talk about an accommodation that might help in the classroom, I can't say that I think your child has this condition. I can't give any tips related to medication. That's better left to the people who, just for lack of better words, know what they're doing. But I do encourage, feedback, and I encourage, communication. I would love to, if you have a question, help you out. I would also like to kind of say before I say anything else that I'm going to talk about diagnoses. And while I talk about diagnoses, I'm going to use terminology, and I'm going to try to define the terminology as best I can. But you can diagnose a condition, you can't diagnose a person. So I really want to make clear that a person is not a condition. That while a child may have some kind of condition, it's a very, very, very small part of who they are. And I do not want by any means to change the way that anyone sees kids. And I do not by any means want to give the impression that all these things can be generalized. Kids are different. People are snowflakes, in my opinion. And it's just really not possible to find a one thing that helps, everyone, or one thing that hurts everyone. And often, what helps one person might hurt another person. So it's just good to keep that in mind as I'm talking about these conditions and saying things like kids with Asperger's syndrome or kids with ADHD. Some of the generalizations might be there, but they may not necessarily be applicable to any one kid. I'd also like to make clear that diagnosis is not prognosis. In other words, while I am going to talk about some conditions that some people consider to be more serious, such as childhood schizophrenia or childhood bipolar, and also ones that some people praise as less serious, like ADHD, or maybe even like light Asperger's, I personally do not believe that a diagnosis can say what a person can do. And I've seen, over and over people overcome these conditions, and I personally believe that anyone can recover, that kids do well in the right environments, and that, diagnosis, for lack of, just isn't prognosis. So I guess a really good question to ask would be, what are mental health conditions in kids? Mental health conditions are biologically based, basically health issues that can sometimes be expressed as behaviors, and they can be willful. Sometimes they are. Usually behaviors are willful, even in kids with mental health conditions, they are willful. But the behaviors may be influenced by emotions, they may be influenced by processes that, those around the kid can't see. So, while an adult may express depression, sadness, guilt, disinterest, a kid might just refuse to comply. They might be defiant, irritable, aggressive. They might start showing up to school late, just not wanting to go to school at all. Skipping classes, not turning in homework, withdrawing. And a lot of that really looks oppositional. And it can be hard to tell what is and what isn't. But when these things appear suddenly, sometimes there might be something more going on, and it's always best to be on the safe side. In the same way, anxiety often looks like nervousness, worrying, restlessness in kids, like hesitation to try new things, refusal to try new things, school avoidance again, hyperactivity and withdrawal. So it's hoped that the behavior will cue to something biologically different. However, since mental health conditions are often expressed behaviorally, they're sometimes treated as misbehaviors. And so when kids, begin having trouble in school, like difficulty with grades or, in behavior, they are often told they're not trying enough or told they're bad or stupid. And it's really sad because sometimes kids start to believe that, and sometimes kids try to live up to that title, and that's just really awful. But not all that's different is disordered, and not all that's different or disordered is bad. A lot of kids with mental health conditions can go on to do really cool things. For example, kids with ADHD, even though there are specific deficits in attention, they might be more distractible. They might not be able to focus on what the adults want them to focus on. They might have specific strengths. For example, they may be able to multitask really well. They may be able to hyper-focus really well. And they might have one specific thing that they really like, and that's definitely positive. In the same way, a recent study found that kids with Asperger's scored higher on a test of intelligence as the Ravens test of progressive matrices. So there are good and bad things, and a difference is not either way. But it is a condition if it affects a person's life, if it's disruptive to the person, if it's disruptive to the people around them, and if it's distressing. So that's really what mental health conditions in kids are. Some things that can kind of hint that something might be different. And that's what I'm going to leave with today. Okay?